Hi, I'm Bill Santamore. I'm the managing editor of Hospitals and Health Networks magazine, and I'm here with my senior editor, Matthew Weinstock, and we're going to talk about the May issue of our magazine, H&HN. And Matthew, the cover story is about health coaching, which is another way of saying patient engagement.
Right.
Why is that important?
I think it's important for a lot of reasons. I mean, one is as hospitals are much more focused now on their outcomes and quality, getting the patient engaged in clinical care and their treatment protocols and following their treatment protocols is really important.
And they've always, for years, people have been saying the patients are the one missing link in the care delivery team.
Right, and even as the story was coming out, Health and Human Services Secretary Sebelius released her report on national priorities for healthcare quality improvement, and patient engagement is one of those top priorities. And so it's really important for hospitals and doctors to get on board with this, and we provide some really good case studies of how hospitals are engaging their patients.
Some practical advice.
Right.
Real life examples. I like that. Another thing that's interesting in this issue is our gatefold, which is our fold-out section that we run every month in the middle of the magazine. And this one is about value-based purchasing and bundled payments.
Right, and another timely topic because the CMS recently released its final rule on value-based purchasing, so how hospital payments are actually going to be tied to providing value and outcomes. And this gatefold really provides some examples of how value-based purchasing is going to change your payment structure.
Another interesting thing we have in here is something we do every May. It's our special section on finance. This year it's called Delivering Change, and basically it's a series of expert commentaries on capital issues. And this year we've got Fred Hessler, Joel Allison, David Byrne, Mark Eustace, Rodney Hochman, and Anthony Tersini. Another big issue that we cover in the magazine this month has to do with meaningful use.
Right, we have two things on meaningful use attestation, which is the process by which hospitals tell CMS they've met stage 1 requirements for meaningful use. So we have an inbox story, our lead inbox story, looks at the challenge or question that hospitals are facing of should they apply now for those incentives or wait a year or two even if they think they're ready. And the story quotes a Chime survey that said that only 32% of respondents were actually going to apply this year for meaningful use incentive money. So there's a real question for some hospital CIOs, and in that is, they don't know what stage 2 is going to require yet. Will they have time to meet the deadlines that stage 2 is going to lay out? So there are some real big questions from the answer.
But you also focus on somebody in your column that has decided it is time to go forward.
Right. I talked to John Stanley at Riverside Health System, and they were one of the first hospitals to actually go through attestation. They actually submitted their documents, I think, 2 days after the CMS website went up. And he said that it was just time. They were ready. They were good to go. They weren't concerned necessarily about stage 2. They have a pretty ambitious IT strategy, so it was time for them to go.
One of the special things we have in the issue that I think is really poignant is what we call our extra mile. And this month we look at somebody who's gone back to Libya.
Right, he's a psychiatrist up in Oregon, and he's a Libyan refugee. And when the war broke out, he decided that he needed to do something to help his fellow native citizens. And he went back to Libya and actually has provided some mental health services for patients there. And he plans to go back a couple times a year, I think.
And he works at the Oregon Health and Science University.
Right.
Very moving story. Brave guy.
Right.